In a provincial hospital, a patient with severe chest pain is admitted, but the local doctors have no experience in cardiology, so they're asking an expert doctor from a university hospital for consultation. The expert performs a complete ultrasonic examination of the patient's heart remotely, using a robotic system. And here it is how it works.
Nowadays, the doctor sits next to the patient, manipulates the ultrasound probe with one hand and the control buttons with another, and observes the images on the screen. In our approach, we split this into patient side and the doctor side, which can be in two completely different locations: hospitals, cities, even countries. It does not matter. On the patient side, there is a robot, having an arm with the ultrasonic probe and a head with cameras, microphones and display where the face of the doctor is shown. An assistant, either a technician or a nurse, is setting up the robot and overlooking the whole process. On the doctor side, there is a console with a 3D screen with a probe view, the picture from the ultrasound scanner, the teleconferencing system, a joystick, scanner controls, and a haptic input device for controlling the robot arm. The doctor interviews the patient using a high-quality teleconferencing system. The robot head may be adjusted either by the assistant or by the doctor using the joystick. The doctor can choose between 2D or 3D cameras placed on the robot head or body. The doctor can also talk privately to the assistant without being heard by the patient. The assistant prepares the robot, puts gel on the probe and sets up the arm to the position asked by the doctor. Although it's a robot, no programming is needed. It's enough to grasp the robot hand and place it where required. The robot has force sensors in the arm. It recognizes that it's being grasped and follows the assistant. Once set, the control is passed to the doctor, who uses the haptic input device to move the ultrasound probe, which follows exactly the motion of the doctor's hand. This device has force feedback so that the doctor can feel and control the forces between the probe and the patient's body. The patient lies on his left side, like during a standard echocardiography. Since the robot arm has human-like kinematics, all typical echocardiographic poses are possible: parasternal, apical, subcostal, etc. The examination is conducted and perceived exactly in the same way as the direct examination, and the examination time, quality and results are identical. The doctor has the unique feeling of being physically present at the patient, helping patients that would be out of reach otherwise.
The shortage of highly qualified medical personnel is observed worldwide. It's a serious problem since either people in need or doctors have to travel for a long time. And time is not only money in this case, it's life. The emerging telemedicine includes video calls and sharing X-ray pictures, ECG, pills, etc. One important feature is missing: the ability to physically interact with the patient, which is essential for performing an ultrasound scan, one of the fundamental diagnostics methods in the modern medicine.